Todd Auerbach, tell us a little bit about the difference of, if there is one, because I really haven't figured that out yet, but the difference of a veneer and a luminaire. You see advertising luminaires and you see advertising veneers, and to me they're all clip-on fingernails, tooth nails. But what is the difference, if there is any, and when do you use one over the other one? Is it something as patients need to be concerned, or is the doctor totally taking care of it in the first place?
Well, great question. The doctor should be taking care of that. Basically, a luminaire is a veneer. So it's just one company's brand name of the porcelain that they use to make it. So like a fingernail, like you were mentioning, that's basically a plastic material, whereas the veneers are porcelain. So they're more durable, and they hold up. They don't pick up stain. And so the difference is that some preps are needed and some preps are not needed. Usually with the luminaires, you do very minimal or no prep. And with other veneers, depends on the doctor you go to, could be almost like a crown preparation where you're taking a couple of millimeters off versus maybe a couple of tenths of a millimeter. Personally, I like to do things as conservative as possible and stay in the tough outer part of the tooth. If we have to do any modifications of the tooth, if there's maybe an overlap, we will shave that down so that our veneers, when we're done, can be nice and smooth looking and not too thick. So I use both types, regular veneers, sometimes luminaires. That's just the difference between the porcelain and the company that's making them.
Got it. So you, the dentist, would choose that. So, for instance, if a person has a crooked teeth in front, like a little rabbit type of whatever bended thing, and if you need to grind them down anyway or so, then maybe you might need a luminaire anyway, a veneer anyway, because if you just hit the luminaire over the tooth still would be crooked. Is that kind of a situation?
Well, the luminaire is, like I said, a brand name, so it could be used in any situation as well.
Okay, so
it's just a brand.
So you can grind the tooth if you want to.
Yes.
It's just sometimes if everything else fits, whatever that is, the size, the this, the that, the space between the teeth, then sometimes you might not have to grind because they're making them so thin that you couldn't just put it on.
That's correct.
Beautiful. So what are luminaires / veneers? Like, what are they used for in a person? Why does a person get them? What are some of the reasons, the main reasons?
The reasons would be if they're not happy with the tooth shape, color, position, and things like that. If they didn't want to do orthodontics or Invisalign to straighten the teeth, then you can put these covers on and make the teeth all look like they're nice and straight. Still, ideally, you would do the straightening of the teeth because then it's easier to keep the teeth clean from the backside where the roots are sometimes overlapped if you do the straightening first. If there's cracks or missing parts or, like I said, colors or shape, stuff like that, you can do a veneer on it and or across the smile and make everything look natural.
So it's very cosmetic, basically.
Yes. I mean, there could be some instances where there's like a broken tooth where it helps with some of the function as well, but most of it is cosmetic.
Right. And you said something that, for people who, let's just say, have some crooked teeth, and where even though orthodontic work, be it Invisalign or normal clear braces or whatever, might do a good job and is less invasive and etc., but the person might not want to run around with braces, especially a person who's, let's say, 20, 30, type of thing, even maybe, I don't know. And so then the veneers or crowns for that match, some type of combination, might give him that good smile, not in 6 or 7 or 12 months, but actually within a couple days or a week or whatever, couple visits type of thing, right?
Right. It'd be like instant orthodontics. The teeth look straight on the second visit, usually, 1 to 2 weeks later. Correct.
Well, if I would have crooked teeth, that's probably what I would do, simply because, my level of patience, I don't want to do push-up, not because I stop not being able to do any more push-ups. That, of course, is also there, the level, but I get bored before I'm reaching the level of I can't do them anymore. So I would obviously probably go and say, oh, you can fix that with a couple of visits. Well, let's do it. Today is Monday and Friday. I want to have a date. Let's go out. Let's have it. Do you know what I mean? Beautiful. Well, all right. Thank you very much. And that stuff lasts quite well if you put a veneer on it, or does it come off a few years later? And can you, once you have a couple, 2, 3 or more veneers in your front, can you still bite into an apple? Can you still chew on a prime rib on whatever?
Yeah, they're very durable. They last pretty much like crowns or bridges, an average of 10 years. You can bite into most things. If you try to use them for tools to open things or break thread, you can concentrate enough force to cause them to crack or chip, just like you would a tooth.
Right. Okay. Good. Wonderful. So that's basically, is that what the Hollywood smile people have? I mean, I'm not accusing every Hollywood good smiling girl or boy to have those teeth, but that's kind of like you can create what you want in your mouth with those things, right?
Absolutely. So either they have some veneers or a combination of veneers and crowns, where they have porcelain over the front of the tooth so they can control the shade, the color, the shape, and all of that.
All right. Here you have it. Here you have it. So dentists are not only there. You mentioned before a missing tooth can get you headaches, so you can fix headaches. Your cosmetic surgeon. And so, dentists really have their hands in everything. You're getting not enough credit for what all you do, I guess.
Well, it's very enjoyable. I like doing it all. Some of them are challenging, but that's what keeps it interesting.
Right. Bye-bye.